I want to talk a little bit about gallstones and some interesting things that are related to gallstones. Um, Here's the thing. You have people with a very, very large stone. And then you also have people with small stones, but they have many different stones. And there is going to be a situation where it's beyond the ability to shrink those stones. So there's, in some cases, a need for surgery. But I always like to recommend that we try non-invasive things first, simply because if there's a way to shrink it, that would be awesome. But there's a limitation of matter. So realize there's a judgment call of when to go the surgical route and when not to go. There's an alternative treatment called the shockwave treatment that they can break up the cholesterol stones in your gallbladder. So that's something to look at. I would much prefer this than the surgery. And maybe there's also another option too with removing the stones but keeping the gallbladder. So it's something you'd have to research. So you'd want to know how big the stone is and how many stones you have. If you have a few small stones or you have sludge in your gallbladder, well, that's going to be a lot easier. It's a proven known fact that bile salts can help dissolve gallstones. Here's the name of one type of bile salt, UDCA. The derivation, ursus, means bear because it originally came from the bile salts from a bear. And it's been used for ages. But it's also used for biliary sludge and stones. So medically speaking, they use bile salts for stones. There's a lot of different types of bile salts out there. There's a lot of confusion on what does what. They don't really know a lot of data on which one works better for this versus that. It's kind of a new thing, but it's something that you're going to have to experiment on your own body yourself and try something and see if that helps you, because at this point, there's just not a lot of data on what type of bile salt you need. Medically, you'd have to be prescribed this, but there's a lot of other different types of bile acid that you can get without a prescription that seem to work just fine. The two big symptoms for gallstones, beyond like the bloating or nauseousness, would be right upper quadrant abdominal pain, okay, or tightness. That's number one. And pruritus, which is itching, okay, itching. That's because there's a backup. There's the stones that are blocking the flow, and bile is backing up to the liver, it's backing up into the blood, and that's the symptom of too much bile in the wrong place. So gallstones actually come from a supersaturated condition. It's not enough bile, too much cholesterol. So this condition happens frequently when you're pregnant, when you have gastric bypass, it increases your risk for this, and gastritis, and when you have a fatty liver. Because think about it, in a fatty liver, you're not dealing with the full capacity of liver function. And so you're not going to be able to make as much bile salts. So you're not going to be able to dissolve the cholesterol as easily. Now, if you want a really good protocol for gallstones, you would take purified bile salts, you would take lecithin, choline, all of these together, and you'd want to have a moderate amount of fat. You probably don't want to do a high-fat diet simply because that's going to increase the need for more bile salts. Your problem being deficient in bile is that you don't have enough bile to digest all this fat, so that can create some irritation to your digestive tract. Omega-3 fatty acids also help to prevent gallstones, FYI. Now, the importance of making sure that you have enough bile and everything's working is this. Bile helps you convert T4 to T3, the active form of thyroid hormone. So one big cause of hypothyroidism is a problem in the liver or the bile ducts. In fact, a lot of people develop hypothyroidism after they had the gallbladder out. Now, hyperthyroidism is just the opposite. If you have a hyperthyroid and you're taking bile salts, that's going to make it more hyper. So one contraindication for taking bile salts is if you have a hyperthyroid condition, like Graves' disease, for example. Also, one way that you know you took too much bile is if you had diarrhea, because bile is a laxative. Lastly, a good indication to know if you need more bile is just to really understand the fat-soluble vitamins and what they do, and start noticing, wow, when I'm driving, I can't see that good at night. That's a low vitamin A situation. Or let's say, for example, you have low back pain. That's a vitamin D situation. Or you get depressed. Could be vitamin D. Or you have bruising. That's vitamin K1. So you really need to understand your fat-soluble vitamins and what they do. All right. Thanks for watching. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call. But I put the number down below so you can call and get some help.